Hi, my name is Dr. Garima Verma. I'm a certified medical cosmetologist, and today we are going to talk about a very viral topic which is very much in trend is lip tattoo, lip blush or lip neutralization. So let's understand what is lip tattoo. Lip tattoo is actually depositing color on your very uppermost part of the skin of your lip. So what you should avoid or take precautions just before your lip tattoo is done. So you should avoid alcohol at least for 24 hours because anesthesia would not work if it is a possibility. Then you should avoid taking at least 3 days or 2 days before the blood thinning medications, because obviously when we do lip tattoo, it might bleed and it might be a possibility it might scar. Then you should avoid using makeup just 2 to 3 days before, it is better. Use good lip balm and exfoliate your lips 3 days before every day so that there is no dead skin and the pigment is not infused in your dead skin. Very important thing which you should mention to the doctor or the consultant which is doing the lip tattoo is if you have a history of herpes, you should inform them because you might have to take the medication 3 days prior. The procedure takes around 2 to 3 hours because we start with the consultation, then we anesthetize it, then we shape it. Again, we will discuss it with the client what exactly they want, and then we start infusing the pigment into the skin, which takes around 1 hour as well. So all in all, coming and going takes around 3 to 4 hours. So for the starting of the procedure, when the client comes, we do the cleansing and scrubbing little bit, and then we apply topical anesthesia. Then while the anesthesia is working, the client might choose the lip shade they want. The doctor will suggest with which kind of shades will actually apply, and also will tell that what was the actual color which will come. It is not a lipstick, it's just a tint. It will not be that much dark as the client usually expects. After 40 to 45 minutes, we will remove the anesthesia and start working on the lip shaping, and then we'll start infusing the pigment in the skin. So this was all for the procedure, but now I wanted to show something that when we do lip tattoo, and the healing process and actual pigment comes in around 45 days to 60 days. That's why the next appointment is after 1.5 months or 2 months. As you can see in the photographs, there is a lot of change which is going on in this all days, and for 1 week your pigment will get darker. For next 2 weeks you might feel that we have not done anything, but when the skin will heal, the color will change, and as per your original skin color of the lips and the pigment will mix and show the actual color. So now comes after procedure precaution, what needs to be taken, which is very important. Do not scratch your lips after for at least 2 to 3 days because there might be a possibility of dead skin exfoliation. Then apply good lip balm, keep it moisturized like very good for next 3 days. Please do not take alcohol for next 1 day at least, and avoid using any kind of makeup for next 24 hours. Avoid eating spicy food or oily food or any kind of seasoned food because your lips are very sensitive for next 24 to 48 hours, it might create problem or some kind of itchiness. So these are our actual cases. The first one is a female, very young female. She had a good skin tone, but her lips were very dark, and it was not possible for her to, without lipstick, she cannot go out on a daily basis as well. So as you can see, in this case, we had to do 2 to 3 sessions of lip neutralization first, and then the actual pigment could have been done. This is another case which it's a male patient, very young, but has very dark lips, and laser was also not working for him. In that case, even if when the laser pigmentation was done, the pigmentation was coming after 2 to 3 months again and again. So in this case, camouflage is the best technique which we can use lip tattoo. That's why we did, and we have done only 2 sessions and the result is still pending.